Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. In this presentation, we are going to look at the role of statin in elderly patients ranging in age from 70 to 90 years, whether continuing the statins makes any difference in terms of benefits. The question is, does statin discontinuation in older people lead to increased cardiovascular events? So we're going to see if we can answer this question. To answer this question, Denmark did a study looking at two different groups of people. The first group was the primary prevention group. This is the group which has increased risk factors like hypertension, diabetes, or cholesterol problems, but they don't have diagnosed heart disease. And in this group, there were 27,463 people. The secondary prevention is the group where they already had a heart attack or heart surgery or heart stents, things like that. And this is the group which consisted of 39,955, so almost 40,000 people. And these people were followed from year 2011 to 2016, and part of them continued their statins while the other group discontinued the statins. And we are going to look at the results and see if there were any differences in terms of outcomes. This study looked at the major cardiovascular events. It's called the MACE, commonly in the cardiology field. That refers to major adverse cardiovascular events like heart attacks, deaths, leading to worsening of symptoms, heart failure, among others. Here is the study population. As we said, the primary prevention group had 27,463. The mean age was 79 years in the primary group, 80 years in the secondary prevention group. The MACE, or the risk of cardiovascular events among those people who discontinued the statins, was 1.32. That is almost 30% increased risk in the population that discontinued the statins in the primary group, and almost 28% increased risk in the population that discontinued the statins who already had history of heart disease in the past. So there's a clear indication here. Looking at a population of almost 67,000 people, we see a clear distinction in both groups of increased risk of cardiovascular events if the statins were discontinued. It's always a question, you're past 75 years, you didn't have any heart problem, should you be continuing statins? And this study clearly answers that question as the benefit of continuing statins, especially if you're having multiple risk factors. Showing this in a graphical form, it looks like a very minute change, but nonetheless, the percentage change is something that is significant. Those who continued had this amount of risk, whereas those who discontinued had slightly increased risk to a tune of 38% compared to those people who continued the statins. This is in the primary prevention group. And we see a similar picture in those people who were in the secondary prevention group. So, ladies and gentlemen, in conclusion, first of all, we have to say this is what is called a retrospective study. In medicine, we call this as retrospective. If you're just looking at a population from looking at their records and see what their outcomes were. But in real medicine, in order to prove anything to be of substantial value, we have to do a randomized, controlled, placebo-controlled study. But I seriously doubt we are ever going to do a randomized, placebo-controlled study for 5 years among those patients who are at increased risk of cardiovascular events or who already have cardiovascular events to begin with. But nonetheless, this retrospective study really helps us to understand the value of statins among elderly patients beyond age 70 as how it can help to prevent or decrease the risk of cardiovascular events. There's a typo here, and they suggest more studies need to be done to confirm this. But in conclusion, I would say there is evidence that continuing statins in the elderly population in the ages 70 and beyond, there is still some benefit in terms of reducing major cardiovascular adverse events. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and we will see you in the next presentation.